Well, I think patient safety is in everything that we do in healthcare today. The admitting department, housekeeping, nursing, it's not just a nursing issue, it's ingrained in everything we do in healthcare. At the bedside, doing clerical work that involves the patient, cleaning their room, that's all patient safety. I think that, again, as I said, it is in everything that we do, and how it affects the quality of care is how we interpret patient safety and how we carry it out in our everyday duties, no matter what we may be doing. The top 3 patient safety issues, I think communication is definitely the top one that I see. Joint Commission, that is their #1 issue that they look at, because communication is everything. You can have goals and you can have policies, but if there's not the correct communication, it's not going to be carried out correctly. Certainly anything to do with medication safety in a hospital setting, and it's a very broad, is important aspect of patient safety and the care that we give. The third thing I would just say that knowing why we do the things that we do, understanding the reason why we have a particular policy or a particular step-by-step that we do in healthcare, understanding the reason for it. When I was a nursing student, I was involved in a medication error, and it was just because I did not follow those simple steps that we all know and we all are aware of, and if you miss one, you will make an error. And I was totally devastated. The patient was fine, but I left out one of the steps, and it was not double checking, and also not listening to the patient who questioned, are you sure this is my medicine? That day I still remember, and I still get chills every time I think about it. So I remember that every time I went in to give a patient, not just medication, but any kind of treatment, because it just was devastating that could happen. But it can happen if we don't follow those simple steps. Well, in preventing medication errors, in my line of work as a compliance coordinator, I think it helps for me to go in and occasionally observe a med pass or a medication administration. It helps me to stay focused on the steps that we are supposed to do. It also is helpful to the staff to remember those steps, and we talk about it before we go in the patient's room and afterwards, and what was left out or what could have been done differently, and the whys of why we do what we do. I think the electronic health record itself is good. Technology has certainly advanced, and healthcare has to move along with that advancement. However, in my work, I see that in some cases with some staff, with some nurses, it affects their critical thinking skills because they spend so much time on the computer, and depending on the program that their hospital has, it involves a lot of repetitive work, repetitive computer work. So I think it in some ways can affect critical thinking skills, but I think it also is very good with documentation of some of the things that nurses have to document. It certainly has works to eliminate eligibility issues, and just that is a big thing in itself, legibility. But I think as we move along, certainly the healthcare workers of today are used to computers. They grew up with them, and I think it's been more of a challenge for older staff that I have observed. But I think in the long run, electronic health record is good. It's just how we use it that determines how it's going to be perceived. Well, in our facility, in our healthcare company, we have an entire IT department that is available in each hospital to work out issues. The nurses have a help desk number that they can call 24/7 if they have any issues. Some of our IT staff are nurses themselves, so they know the nursing side of the IT programs, and that is certainly helpful to have them in the hospital. So the IT department in a hospital setting has become a really big new issue